Hi, my name is Kirsten. I'm your dental hygienist today. We're just going to go over some different oral hygiene instructions so you can properly clean your teeth.
Okay, sounds good.
So how many times of the year do you visit the dentist usually?
Probably like once a year. I'm really busy with school and stuff, so I really don't get there very often.
Make sure you try and get there at least twice a year so that you're removing all the bacteria and plaque that builds up on your teeth. So how many times a day do you usually brush your teeth?
I try for 2, but most of the time I forget before I go to bed because I'm just so busy and I stay up all night studying.
How many times a day do you usually floss?
I don't really floss ever.
Do you use any other adjuncts?
Adjuncts? What's that?
Like mouth rinse, tongue scraper, a water pick, anything like that?
Nah, I don't got time for that.
How often do you usually change your toothbrush?
Wait, you're supposed to change your toothbrush?
Yeah, you should probably change it like every 3 months. So being a college student, do you think you're getting enough sleep?
No, I'm super stressed out and I got a lot on my mind.
So you want to make sure you're trying to get at least 8 hours of sleep for your overall health, and a lot of people are unaware this actually can affect your oral health as well. Would you say your diet is high in sugar and carbohydrates?
Yeah, I eat a lot of mac and cheese and candy, and at night when I try to study and stay up really late, I chew bubblegum.
Because of the foods that you're eating, it's actually creating an acid in your mouth, which is then breaking down the tooth. So you want to try and avoid those foods, or if you are eating them, you want to make sure that you're brushing right after you do eat them. So if you want to chew something while you're studying, you could chew gum that has xylitol in it. Xylitol is an ingredient that can help prevent cavities. So how often would you say you consume alcohol?
I go out every weekend, so Thursday through Saturday I probably drink quite a bit.
So alcohol can actually cause dry mouth, which we call xerostomia. So when you are consuming alcohol, you want to make sure that you are staying hydrated by drinking a lot of water and you are brushing your teeth before you go to bed. So this instrument mimics a ruler. It's used to measure the depth between the tooth and the gums. This one specifically goes up to 10 millimeters. A reading between 1 to 3 millimeters is a healthy mouth. A reading of 4 millimeters is considered gingivitis, and a reading anything above is periodontal disease. So now I'm going to take your readings. So when I was getting your measurements, I got a lot of 4s, you had a lot of bleeding in your mouth, and your gums are also very red. So this means that you have gingivitis, which is an inflammation of the gums caused by irritation from plaque buildup. This is a picture of what your gums should look like versus what they do look like now. Because you have gingivitis, it's important to know that it is reversible, and if you improve on your oral self-care at home, you can get your mouth back to health. So if you don't improve on your oral self-care at home, there is a chance that you can develop periodontal disease. So periodontal disease is an infection below the gums that causes bone loss. It is important to know that periodontal disease is not reversible, and once you get to this stage, you cannot get this bone back.
Is that going to happen to me?
Because you're a college student and you're not properly brushing or flossing, you do have the potential to develop the periodontal disease, or you could also develop necrotizing ulcerative gingivitis. Necrotizing ulcerative gingivitis, otherwise known as NUG, is a rapid form of disease. Because you have poor oral hygiene, you are at a higher risk of developing NUG. Symptoms of NUG include flattened gums between the teeth, fiery red gums, bad breath, and pain.
So how do I brush my teeth and take care of my teeth so that I don't get that? Because I don't want that.
So the technique we use to brush is called the modified Bass technique. You angle the bristles of the toothbrush towards the gums and you do circle motions, and then you sweep away from the gums and you move to a different spot. The toothbrush should cover about 2 teeth at a time. The toothbrush that you should be using should be soft bristled as well as nylon bristled so that it dries faster. You want to also make sure that you're brushing your tongue with no toothpaste on it so that it's less abrasive. So when you're flossing, you want to take about an arm's length of floss. You want to wrap the floss around your middle fingers, more on one side than the other, usually the more dominant hand. So when you're flossing, you want to seesaw the floss in between the teeth, and then you want to make a C shape and go up and down between the teeth, and then you just want to switch to the other side, do the same thing on the other side, and then seesaw it out. Every time you go to a different tooth, you want to make sure that you are going down on the floss and getting a new piece.
Wow, thanks. I feel like there was so much I didn't know about how to take care of my oral cavity. Now I'm so prepared to have a healthy mouth. Thanks for watching our video on how to take care of your oral cavity. If you wouldn't mind, please take our post survey so that we can use it for our public health presentation. Thank you.